Hey, I told you we was gonna be here. Let's Get Comfy Podcast, Comfy Measures Media, here live, FADONA Annual Conference. Look who I run into, a Georgia Bulldog fan. A Georgia Bulldog fan. I'm gonna know, and she know. So she was on my show, uh, Florida Healthcare, very recently. So make sure you check out Comfy Measures Media on YouTube. But tell the people who you are.
I'm Dr. Phyllis Kennedy Howell. I work for CHE Behavioral Health, and I'm the National Clinical Director of Psychiatry.
What are you looking forward to in this conference this year?
I want to make sure that our nursing home facility staff understands what mental health is all about and how we can help those residents across the board in making sure that they're safe and they have their mental health care taken care of, and let them know how important that is.
Podcast. I caught this group of people here coming out of this particular session. I want them to tell me, introduce themselves, but tell me what they just learned too.
Hi, I'm Victoria Johnson. I'm Director of Nursing at Terrace Health and Rehab in Gainesville, Florida. A big part of communication with your medical director. That was one of the main topics.
Hello, my name's Nikki. I'm the Director of Nursing at Cypress Care Center. Communication is the key to success. So medical directors and the DON must communicate.
So I'm here with Miss Susan Ginsvold. She made me feel so tall. Thank you. The lady that gave, one of the wonderful ladies, give us the opportunity to be here, the Let's Get Comfy podcast. I wanted to highlight her. If you will, just tell the people what you do and who you are, ma'am.
Well, I'm a nurse consultant, and I also am the first vice president of FADONA.
So tell us your overall experience thus far. I know we kicked off yesterday, but what are you looking forward to today?
Oh, today we're in collaboration with FMDA.
Mm-hmm.
We're going to be having sessions with the medical directors and the nurse practitioners that practice in our facilities.
So tell us how that collaboration came together, because this is the first year ever doing it. And so I know you was a big part of that.
Well, we decided, our convention, trying to have it together would make it even better for both, all attendees that came.
That's a great idea. Well, I thank you again personally from Comfort Measures Media, but also I know this great event. I mean, I see the guests are rolling in here. So thank you so much.
That room's full.
Full, yes.
So Norman Harris is the founder and the CEO of Let's Get Comfy Podcast, a healthcare resource platform dedicated to education, empowering and supporting aging adults and their caregivers. He helps families and professionals navigate elder care with confidence and compassion. Our panel today is Amina, the Vice President of Clinical Services at Ventura Services in Florida. We have Dr. Shark Bird, the President of FAMDA, and then Liz Ford, the Chief Nursing Operator at Millennial.
If you could change one policy in long-term care tomorrow, what would it be?
So if I would want to see something change for the tomorrow and long-term care, it would have been addressing the kind of, I would say, dilemma, us trying to navigate providing care with residents with mental health disorders.
So I'm a physician, and I'm a certified medical director, and we fought for years under the direction of Rob Kaplan to get some minimum standards for medical directors. I would take that and extend that to be all physicians practicing in the post-acute long-term setting should have a minimum amount of hours of training and providing services to those individuals. Providing services to an 85-year-old who lives in post-acute long-term care is different than providing it to an 85-year-old that lives in the community.
Policy change should be, we ask ourselves the question, if it doesn't have to do with safety and quality, should it be removed, right? Meaning, to add this additional type of documentation. Yes, we need to document. We need to document for financial purposes. We need to document for compliance, but I think we keep adding these things over and over, and as something is released from CMS, we should ask ourselves those questions. Is this going to give back to the patient to ultimately bring the nurse back to the bedside?
So tell me, what do you do?
I'm a geriatric nurse practitioner. I've been in nursing homes since 2000.
What's one thing about your job people would never guess?
One thing they wouldn't guess is the total flexibility that I have. If I have a patient that is not doing well or a family that needs more time and attention, I have that opportunity to do that, to sit and talk with you, to answer questions, to explain what's about to happen, where you don't in many settings. So I think, like many people, when I was in nursing home, I wasn't like, or nursing school, oh, I want to be in long-term care. I'm like, no, like we did our mandatory, week in long-term care. We all were like, it stinks, get me out of here. You would never imagine a million years would have convinced me I would have been working for decades in long-term care.
What do you think, why do you feel in some cases technology can be, I guess, sort of in a way detrimental in skilled nursing facilities?
I think besides the obvious, from a HIPAA perspective, from a HIPAA violation, I would say that, if you're calling in as well as being a positive, your roommate could hear some of the intimate things that are going on between your loved one at home remotely and you in the bed. I think that it also increases that risk of, right now, I think that it's on the a law to be passed, I think, with the state as far as video conferencing, again, to allow that in the nursing home. So that piece, again, I think it crosses that line between what we do in our home-like environment, providing that level of dignity and respect to the resident. And, with innovation comes that resident right piece. So it really is significant. So we have to be careful of that, not to go too fast.
I like that. Great answer too.
I'm Julie Ruff. I'm a registered dietitian, renal dietitian by trade, now working in long-term care and for Vita Fuel Wellness Protein.
Yo.
So we're going to do a live sampling today.
Yes.
Berry versus citrus. He's being brave. It's a room temp sampling, so we're gonna go for it.
All right, so I think
Smell it. If you want to see. The reason it's that color is because
very
we
well.
don't use no artificial sweeteners, colors, or dyes, or any flavoring.
All right, okay. Boom.
This is the berry.
Vita Fuel, berry. Okay.
Kind of like a yogurt.
Like a yogurty and smooth too.
Yeah.
I like it.
Easy to get down. And then the next one is the citrus. This one.
I like the citrus too.
Citrus?
Citrus. But
Team citrus.
But I would say I would rate it, we got to do a rating, right?
If you had to choose, you're a resident in long-term care and
Yeah.
you have to pick one, but you need extra protein.
I would say both of them actually.
Yeah.
And because this is not chilled, this is not over ice, this is just room temperature.
Just took it out of the box.
So actually, I would drink this, to be honest with you.
I take it after the gym.
See, I was about to say, I would drink this. This is really good. Good job. Vita Fuel.
And whey protein.
Yes. So let me do it. Let's do a shot here.
Yeah, absolutely.
Vita Fuel.
Vita Fuel.
You know what, Vita Fuel? You guys should be the sponsors of the show. You know that? Yeah, your boy. Norman Harris, host of Let's Get Comfy podcast. Possible new sponsors, Vita Fuel. That sounds real good. And Miss Julie Ruff, thank you so much for joining there.
You're welcome.
All right.
Thank you.
Yes, ma'am. So I ask you, Dr. Bird, what's one leadership move that really strengthens a team, a care team?
Yeah, inclusiveness of all the members that are involved in the patient care. As a wound care physician, it wasn't just me. It was the wound care nurse. It was the DON. It was even the maintenance staff of the facility. If I've got a bed that's not working properly to keep the patient in the elevation that I want, then that person needs to be involved in that care. The CNAs are the frontline individuals who are going to find over half the wounds that we see as they provide regular care on a daily basis. So I think to develop that team, you have to include everyone that's involved in that patient's care.
I completely agree with you. That is number one, because everybody want to feel like they're part of the team, their voice matter. The other thing that I would say, with the leadership team, making a team a successful team, is appreciation and recognition. People love to know their hard work is appreciated and they do strive in recognition. Not because everybody they already get a paycheck and all that. No, we all know our staff, everybody's working, yes, they get a paycheck. But when people see that you care about them, you appreciate their hard work, they will go above and beyond.
So if you ladies would please introduce yourselves.
Hi, my name is Paulette. I'm the clinical lead for the ROSE program here in Florida.
My name is Sarah. I'm the regional liaison for the ROSE program for Florida.
So tell us what the ROSE program is.
So the ROSE program is a palliative care group, and we specialize in skilled nursing facilities, LTACs, and ALFs. And we are just palliative care focused. There is no hospice affiliation or association.
Okay. In 7 seconds here, if you'll tell why people should stop by your vendor here.
Yeah, I believe people should stop by because with palliative care, we're here focusing on symptom management, quality of life, and providing family support and helping reduce hospitalizations in the skilled nursing facility setting. So I hope that when people come and stop by, they take that away from us and that we are patient-centered and patient-focused.
Hey, my name is Brendan. I'm from Vital Care. We're a company based out of Utah, and we provide telehealth services after hours, nights, weekends to medical directorship groups. You can see here our sign. We support caregivers, but we're elevating patient care across the nation. Our service, we are the leading after hours telehealth, nights, weekends, holiday service in the industry. If you are a provider and you're tired of not being able to sleep, you miss the imbalance with your family, we are the solution for you. If you are a nurse and you are tired of waiting for providers to get back to you when you need help at 2 in the morning, we are the solution for you. Please come by and check us out.
No, it's building your interdisciplinary team members. You know, if you're not in the building, you know, what really defines you as a leader, as a director of nursing for all of you in the building is it's when you're not there, you're on that cruise, you're taking that work-life balance. That your ADON, your unit charge nurses, they're doing what you would do. You would expect them to do that. So, you know, if you're a new DON, right, that's going to be your goal, is to make sure that, you know, you continue to build your team. You know, in my role, I would expect the same thing from my regional nurses to the facility level staff and, you know, and the people above me, right, that we continue to grow.
Ms. Betty Lou Barron, the woman who gave me this opportunity, made this all possible for Comfort Measures Media. You know I appreciate you. Tell me, how do you think the event's been going so far?
So this year's our first year that FADONA has collaborated with FMDA, which is the Florida Medical Directors Association. And I think it's been a great turnout,
yes.
A lot of great collaboration. Just came out of a session with Cindy Froning from NADANA, from our national organization. And she just gave a wonderful, powerful presentation on medical directors and directors of nursing.
Yes.
So we're really excited this year and looking forward to continued opportunities to collaborate with other medical professionals. And yeah, I'm very happy and pleased with the conference, the turnout, and I'm so glad you could be here.
Thank you, thank you. So I had to stop another person here that I think we in competition of best dressed today. So who do you think best dressed out of you and I?
Well, I have to say you for sure.
No.
Yes, amen.
Yes.
You know, and also the energy that you brought today.
Thank you.
Really highlights the shirt too.
I appreciate it.
Yes.
So just from the shoes all the way up, I gotta vote you. Okay.
No.
Can you just tell the audience your name?
Yeah, hello. I'm Tracy Monfort,
All right.
and looking forward to a great conference today.
Thank you so much. I appreciate it. So I want to just send a message to all our nurses, physicians, people and healthcare professionals in general, whether you work in the hospital setting, our fire department, any advocates out there. Like, you deserve to be highlighted. You are a true hero. You're the hard workers. Now we have the movie stars that we watch on television, but the people that really do the hard work, that's what I'm about highlighting on the show. And I think you all should champion and take an opportunity to pat yourself on the back, right? I'm going to do that for you as well. And that's what I'm all about with the Let's Get Comfort podcast and Comfort Measures Media, because people do a lot of hard work and good work in this world, but not enough is said. And I welcome and thank so much FMDA and FADONA for having me here to highlight the true professionals. I mean, one, they go to school for a long time, right, for this accomplishment, but then they play the background role, you know? But no, we put them up at the forefront over here. We're gonna make them shine bright like a diamond. Ooh,